younger people are being affected by heart disease. In fact, the average American has a heart age that's 7 years older than their actual chronological age. And main risk factors, the top three have always included having high blood pressure, as well as having high cholesterol, as well as smoking. But there are other risk factors such as obesity, not eating well, as well as physical inactivity. But a most recent study actually showed that cannabis use has also possibly a cause, as we've seen a number triple in those that had cannabis use dependency or disorder from 2007. Now in 2018, we're seeing that this has substantially increased, especially with the legalization of cannabis.
Dr. Fabi, more than 650,000 people in the country die from heart disease every year. Why do you think we don't hear more about it and ways that we can protect ourselves from it?
I think we've almost accepted that, it's something that may be the reason why many of us die is heart disease. And I think that we take for granted the fact that we can be doing things very early on in our lives to try to prevent it, whether it's not smoking, whether it's decreasing our sodium intake with our meals, whether it's exercising. Exercising is more than just to look good or have a small waistline, but it's also 150 hours a week has been shown to minimize the inflammation that ultimately causes heart attacks. And so I think that we don't really talk about it because ultimately all of these changes happen over many years. And so we think that if we're bad this year, then perhaps, we have another year to make up for it. But that effect ends up being cumulative. And it's not just a heart attack, it's also a stroke, which can also be extremely debilitating.
Obviously, all those things are important to remember. February is Heart Month, but we really have to remember it all throughout the year. Dr. Sabrina Fabi, we appreciate you.
Thank you so much for having me, guys.
Thanks.